Hello, everyone. Sorry for the delay. We just were covering some technical difficulties. We're there. We're going to wait just a couple of moments to have everyone sign in, and then we will start right away. Thank you for your patience. All right. We want to respect everyone's time, so we're going to start. Good morning, everyone. I'm delighted to welcome you all to our webinar on reducing food waste in health facilities. My name is Hibartel. I'll be your host for today's session. I am the Education and Outreach Specialist with the Santa Clara County Food Recovery Program. The program is in charge with the county-wide implementation of SB 1383 food recovery requirement on behalf of all the cities in Santa Clara County. We are responsible for identifying and providing education and outreach to regulated entities, as well as identifying and providing, as well as collecting and reporting and monitoring compliance, including conducting inspections. I would also like to introduce Kira Lowe. You'll see her there on the screen as well. Kira is the program manager for the Santa Clara County Food Recovery Program, and Kira will be discussing SB 1383 requirements as well as setting up your donation a little later in this webinar. Today, we are here to explore practical strategies and creative solutions to prevent food surplus, a challenge that significantly impacts the food service industry. We have a lineup of really gracious and wonderful experts who will share their insight, best practice, success stories in food waste reduction at their facilities. So whether you are a nutrition director, an operation manager, or simply passionate about sustainability, this webinar offers valuable knowledge and actionable tips that you can implement in your own operation. So thank you for joining us again, and let's begin. Just a couple of housekeeping tools. Please do not hesitate to ask questions you may have. We will answer the questions at the end of the session. If we don't have time to get to all of the questions, we will follow up with you after the presentation to ensure that your question is answered. We have compiled many resources from industry groups and businesses across the country. We will share best practices around food waste prevention. We will be giving tips on reducing food waste. That being said, you are the expert. Please chime in with your own food prevention strategy. We would love to hear from you, and as well as share it with other people that are joining us today. A survey will pop up when you leave this webinar. It would be great if you can take a minute just to answer a few short questions. We would love to get your feedback. This webinar will highlight resources and best example on food waste prevention. It will also provide examples and case studies of health facilities who have successfully reduced and prevented their surplus food. And then Kira will join us to provide information on the state law SB 1383 requirements, as well as how to set up your food donation program to donate your surplus. We are aware that you might know some of these prevention strategies, but we are hoping that you pick up some new ones today. So let's start briefly putting this issue into context. According to Practice Green Health, hospitals are responsible for a significant amount of waste, with over 30 pounds generated per bed each day. Food waste constitutes a considerable portion of this, an estimated 10 to 15% of the total waste, or approximately 288,000 tons annually. Health facilities are unique because they typically manage multiple food outlets, which means conducting a baseline assessment is crucial for pinpointing food waste sources and focusing on effective reduction strategy. This roadmap you see in front of you shows opportunities across these various outlets to reduce your food waste. While composting and donation, the green and the red boxes or rectangles in the graphic are a great way to reduce your food waste, the best strategy is to prevent it from happening in the first place. We will spend the first part of this webinar focusing on those prevention strategies. With the numbers that I just mentioned in mind, the statistics, it's important to recognize that when food is wasted, so too are the land, labor, energy, and other resources throughout its production, processing, transportation, and all of the other, such as sorting and preparation. Therefore, reducing food loss and food waste can benefit the environment, the community, and businesses alike. Prevention is key to stopping food waste before it actually happens. Therefore, the Environmental Protection Agency most preferred pathway is to prevent food waste, while the least preferred is sending that food to landfills. Reducing food waste production or eliminating it altogether is the best way to minimize environmental impact of food operation. And this approach, which you will hear in the next couple of slides from our speakers, this approach also makes a business sense with potential cost saving for your facility because you are reducing the food cost. In the next couple of slides, I will provide a high-level overview of prevention strategies that we have compiled, while our speakers will delve into specifics. For now, consider this as a checklist. Feel free to take notes as we explore further in this webinar. And so with the way we've done it, that we've organized them in two major segments. So we will focus on back of house, and then in the next segment, we will discuss details regarding prevention in front of house. So in back of house, you can, some strategies are managing inventory by making use of inventory management tools or softwares to help you have an accurate inventory before placing an order, as well as diminishing stock by encouraging first in, first out approach. In addition to that, increasing delivery frequency, thus ensuring that your stock is rotating regularly. Therefore, you have less spoilage and surplus, as well as increasing communication with your supplier and letting them know about your food waste strategy. And of course, buying locally and seasonally, which will be mentioned later on in the slides. Finally, tracking waste is one of the best ongoing food waste prevention strategy. The bottom line is you cannot manage what you don't measure. Next slide, please. Tracking waste allows you to establish a baseline, which is essential to setting your goals and then measuring your progress. Observe trend in waste generation that can help you pinpoint seasonal variation and menu item popularity. As well, it allows you to identify the problem, such as inefficiency in the food preparation or inefficiency in inventory management, and also makes your employees aware of the amount and the type of waste generated, which can lead to mindful practices. Measuring the amount of food that is most commonly wasted and where is this food or where this waste occurs is a good place to start thinking about how to reduce your food waste. In addition to understanding where the waste is originating from, for example, the kitchen, the customer plate, helps you identify opportunities for waste reduction, tracking where the waste ends up. Is it going to landfill? Is it going to compost? And assigning a monetary value to the waste can highlight the financial impact and motivate efforts to reduce that waste. In cafeterias and food service establishments, it's predicted that 4 to 10% of all food purchases become pre-consumer food waste. This includes reasons such as overproduction, trim waste, expiration and spoilage, improper food storage and handling. Therefore, training your team on knife skills makes more efficient cuts that utilizes more of the food being processed. Additionally, making sure that all the food items are placed in proper storage areas, in appropriate containers, and at optimum temperature. Therefore, you're reducing that spoilage and waste. Ensure proper labeling of all perishable products in the kitchen, as well as educating your staff on the benefits of food waste prevention. Moreover, effective examples of preparation techniques such as batch cooking, make to order, dressing proteins at the finish before you send them out, or even centralizing your kitchen prep will be discussed in details by our speaker, but they are a key practice to reduce your food surplus in kitchen. Finally, using ingredients in multiple dishes or repurposing ingredients utilizing vegetable peel or trimming or creating stock or for soups or garnishes adds a value to an ingredient that would otherwise be discarded. So you might also here think about incorporating the items of your emergency food supply into your menu when these items need to be replaced, and therefore this is a resource that has not gone to waste. All right, so you'll take a break from me for a little bit, and then I would love to introduce our first speaker, Jill Martin, who is a senior director at the Food Nutrition Services at UCSD Health. Jill will be sharing some practical strategies that would have helped her address the food waste and reduce food surplus at UC San Diego Health. And here is Jill.
Hi, everyone. I'm Jill Martin, Senior Director of Food Nutrition Services for UC San Diego Health System, currently overseeing 3 hospitals, one just quite recently. And I'm here to share a little bit about our story, our journey through food waste diversion, donation, tracking, and some of our strategies that we've been able to implement over the years to help with this process. So a number of years ago, we were operating our patient meal service as Cook Chill. So we were producing quite a bit of food, then chilling it, reheating it, and serving it to patients. With this style of service, we were seeing close to a 30% plate waste. So apparently not the most appealing food for our patients. Our meals per patient at that time were about 3.1. And with some changes that were coming with CDPH and a greater focus on patient satisfaction, we wanted to just look into some other options and see what we could do to help increase our patient satisfaction scores. At the time, we were in the 10th percentile and lower, which is not good. We wanted to see what we could do to really increase our scores, provide better food to our patients, and hopefully reduce our waste in the process. So during this time, as we were reviewing, we visited a lot of other sites. We looked at other styles of service, and after all was said and done, we transitioned to room service, which allowed us to prepare food to order. And with this change, we saw an incredible change in our patient satisfaction scores. We actually went from below the 10th percentile up into the 90th percentile, which was huge. We knew that this change was clearly beneficial, for our staff, for our system, but most importantly for our patients. With this new style of service, it was very clear that they were enjoying the food more, and we were seeing a great reduction in our plate waste. We moved to under 5%. So a huge drop in plate waste coming in from patient feeding. As I mentioned, our patient satisfaction scores went up, and our meals per patient actually went down. So we went down to 2.5 meals per patient as a result of this change. So now we were actually purchasing and preparing less food than we were previously. I know there's a lot of concern about the additional staff required for running a room service operation, but we were actually able to use some of the savings from purchasing less food, wasting less food, and it allowed us to hire some more staff in order to support the room service program. We also use the staff to really focus on taking orders from patients that really catered to their needs. So what is it that they were looking for? We could tailor the menu items. We were not stuck to a lasagna or a pan casserole that was pre-made, already cooked, no opportunity to make alterations to it. And a lot of that was leading to our original plate waste issue. So some of the strategies that we implemented through this, we started to change our menus and we were looking at how we can really cross-utilize ingredients. So now our retail menu, our patient menu, and our catering menu all have very similar menu items on them, if not the same menu items. And this has allowed us to really reduce a lot of the ingredients that we're purchasing, overproducing some ingredients that maybe we're not using as often, and being able to use just a couple of staff members to produce, say, 1 or 2 ingredients for the whole spectrum of our meal service. We're also able to part cook certain items. So we do a lot with our soups, where we may produce a base, and then we actually, say for chicken noodle soup, we're producing pasta separately, and then we're adding it to the soup closer to the end, so that we can really use those noodles, that pasta, the base, as long as possible. Let's see, what else we are also, well, I should say that we're using that soup across all 3 categories of meal service as well. So soups that we're serving in our retail areas for customers, for staff, for visitors, we're also using those same soups for patients. So a lot of our menu items are designed to meet our patient nutrient goals and our therapeutic diets, but then we're also able to use them in our retail areas. So essentially, our staff are also getting healthier food from these types of menu changes that we've made. We're also using seasonal produce. So this has, again, allowed us to use a fresher, more appealing option for our produce. We are purchasing, we actually receive produce several times throughout the week. We are not set on certain items being on our menu every single day. So this allows us to bring in whatever is seasonal. We work with our local produce vendors to bring in items that are fresh, ready to be used. And this is also allowing us to purchase items at a lesser cost. So we're not purchasing, say, blue lake green beans year round, and then finding that they're much more expensive in off season, and maybe not of the same quality. So it allows us to really get as much out of the product as possible by purchasing it in season and not using a lot of canned or frozen produce, vegetables. We found in the past, previously when we were doing the cook chill system, we would have pans of frozen vegetables or sometimes canned vegetables. And once they were out of the freezer or out of the can and had already been heated, we ended up wasting half of that. Our patients certainly weren't as interested in eating frozen or canned items. And so where we thought maybe we were saving on finding something that's less expensive and a frozen option, we actually got more use out of purchasing it fresh and seasonal. So that's been a huge success for us, both on the patient side and on our retail side with our customers and staff and visitors. So some of the tracking that we're doing, we have been tracking our food waste and our donations for a while now. We started this pre-pandemic, and unfortunately we had to shift quite a bit during the pandemic as we weren't able to donate food as often, and there weren't as many organizations that were able to take the food, but we're back on track now. And some of the ways that we were able to make this happen early on, we created production sheets for each area. Earlier in the process, we were using Excel and essentially just typing out our own sheets. And we've since moved to creating production sheets from our nutrition software. So there are several different ways that you can track this and create these sheets. But they would let our staff know what to prepare, how much to prepare, and they were based off of what we were seeing either coming back from the floors. If we saw that patients weren't eating certain items, then we certainly weren't going to produce as many of those, or we would even change the menu to reduce or remove some of those items. We could also see what we were running out of, so we knew we needed to increase production on some of those items. But I think one of the things that was really important was we were not preparing the full recipe of a lot of those items. We were preparing the ingredients, so then they could easily be put together in a recipe to meet the patient's need at the time that the order was actually placed. Previously, we were producing so much food and already composed that we couldn't save it. We couldn't hold it for 2, 3, 4 days. It was sort of a one and done. We use it, we didn't use it, it would get thrown out, or we would donate it. But all of this, it's something we continue to work on. We have dietetic interns who do plate waste studies for us. We have staff that are constantly rounding, managers rounding, supervisors, checking to see what items are we having left over. We're tracking what we're sending out to some of the local organizations that are taking our donations. We are looking at ways that we can better utilize any food waste that's coming off of product. If it's, say, broccoli stems that can be shredded and used in a coleslaw or a salad of some sort, or maybe in a soup. We have also partnered most recently with Food Donation Connection, and they have essentially partnered us with local charity groups. And so they're who we're able to send donations to, but we're also tracking what's going out. It's great that we're able to provide these donations, but we also want to make sure that we're not overproducing. So we look at those and see where we can come back on certain areas, or maybe where we need to make some menu changes. We understand there are a lot of other systems out there that can be used for this waste tracking. And we were previously using LeanPath. We had actually received a grant in order to use the program for a couple of years. And we just found that it was too much for our staff. It does take a lot of work and a lot of time to focus on making sure things are recorded correctly, all of the information is entered correctly, reviewing that report. And it was great that we had an opportunity to try it, but we really didn't have the staff to dedicate to using that system consistently and accurately. So we chose not to move forward with LeanPath, and we have been managing the program and the system ourselves, continuing to make tweaks along the way wherever we can see improvements and make some menu changes, or maybe some of the ingredients we're purchasing. I think one thing that's really important is making sure that your staff are engaged. They need to know why we're doing what we're doing. They love to know the impact, know how many pounds of food we've donated, where we've been able to make some reductions in menu items. Of course, they're always excited to be able to produce less food if needed. Really, we like to hear from them too, and see where they're hearing about maybe food items that are coming back. Your dishwashers are some of your most important staff that can really champion this and help be a part of this. They know what's coming in. They see it as they're scraping it out, or if it's being donated. And so it's really important to have staff involved in this process and get them on board. And then, of course, continuing with your manager rounding, supervisor rounding, seeing what's going in your green buckets, what could be used. Maybe is there an item we can purchase that we don't need to have as much waste of that product? Again, it's we continue to fine tune the process, and while we might not capture everything, we've made some significant changes and have seen some great results throughout the years. So, thank you.
Thank you so much, Jill, for sharing your expertise with us. We're grateful for the actionable tips and the insight you provided. So I'm back, and before we go ahead with our second speaker, I would like to highlight the category that I did mention before, that we talked about back of house a couple of slides before. Now we're going to talk about prevention strategies in front of house. Or during your service. And some strategies are going trayless. So it might be a good idea to try removing the trays from the cafeteria. You might find people who will take the food, the people will only take the food that they can carry. Providing multiple portion sizes help reduce waste by allowing customers to choose the amount of food that suits their appetite. Consider providing bread and garnishes and condiments only upon request. This also ensures that they're used only when needed. Place consumption cues, which could include signs encouraging your guest to take only what they can eat. Use service stations to help control portion sizes and ensure that the guest also do not take more than what they can eat. And repurpose the surplus. So sharing your surplus with staff. So instead of letting that surplus go to waste, this can be a great idea to reduce waste while also fostering a sense of community within the team. And sell your surplus food at a discount is another option. Not only this reduces the food waste, but it also provides an opportunity to generate additional revenue. I would like to pause for one moment to highlight a crucial point that Jill made and Jill mentioned, and also it will be echoed by our next speaker, and that is the significance of the staff role. Like in any business, getting your team on board is crucial for the success. Therefore, communication is key, and an informed staff is your best line of defense against food waste. Again, those are some of the benefits of getting your team on board. Jill mentioned it, and then our next speaker will also go into details about this. So I just wanted to kind of highlight this, and so we can go ahead with our speaker. Allow me to introduce John Polley. John is a program manager at the University of Pittsburgh, Pennsylvania, Center of Sustainability. John will also delve into his prevention strategies and what has worked for UPMC. So here's John.
My name is John Polley, and I'm coming to you from Pittsburgh, Pennsylvania. I work for the University of Pittsburgh Medical Center, UPMC as we call it around here, in the Center for Sustainability. However, prior to that, for the 20 years leading up to this, I was living in kitchens. I was working in kitchens across Pittsburgh, and for the last 7 years as an executive chef in the University of Pittsburgh Medical Center health system. I was at the helm of our women's hospital for the last 5 years before I took this role. And I can tell you that as I looked back across all of my experience and my training coming, leading up to being in healthcare, I noticed on day one that the world was different that I was living in. And I noticed from day one that I needed to do something about it. And so for the last better part of the 5 years, I've been working really hard on all things sustainability in our kitchens. I work so hard on those that I actually am now in a role where I do that full time and taking everything that I've learned and all of the strategies that I've honed over the years and taking that to the other 36 hospitals that we have in our system. So excited to be here to talk to you today about some of the things I've learned, some of the best practices that I've kind of, carved out over the years, and some ways to get over the hurdles that you would normally see whenever you take any type of initiatives like this in a kitchen that might be used to running a certain kind of way. And today we are going to talk about food waste, because if there's one thing I could talk about forever and always and fight against forever and always, it's food waste. And I'm really excited to share some of the best practices I have for you in a healthcare setting. So first and foremost, what we want to start with is cooking this into our culture, is making this part of the every single day for our teams. We might have folks that have worked for us for 35 years or ones that have worked for us for a few days, but each one of them needs to be a part of this. It has to be a kitchen-wide effort. It cannot just be a few really excited folks that are trying to cut down on waste in your kitchen. So the first thing I'm going to talk to you about is making this so that your kitchen is designed and that your positions are designed to prevent food waste. And what I mean by that, from a person-to-person level, on one position, you want to talk to that cook and find out what are the barriers to them. Are they feeling like they don't have enough time, so they're rushing? They might be overproducing. They might be, grabbing too much stuff because they don't want to have to leave the line. They might be holding things out too long because they just don't have time to restock. These are all things you can find through conversation and work with your team because they know what the sources of waste are. And then not just finding out, give them the effort to, maybe reorganize their day, give them a little support during heavier times so that they can have some better support and cut down on waste. Find out what they're holding hot and figure out if there are ways that you could prep that ahead of time and bring it back to heat to order. There are tons of different ideas you will get. And most cooks are very happy to tell you where they're seeing their food hit the garbage can because that causes them time, that causes them strife, and they want to be a part of making sure that gets out of the can. So get that information and work on those job flows, work on those job descriptions, work on those responsibilities, and make it so that your kitchen is ready to fight this food waste. It's as simple as really just finding out a way to make it part of their job and not a second job, not an extra responsibility. If you can, work it into their job descriptions and their performance reviews. All of these will go a really long way and it'll start to create that culture in your kitchen. And just another simple little trick is redesign your kitchen so that it's easier to do the right thing with food, right? So if you have these huge 55-gallon garbage cans all over the place, people are going to throw stuff in there. If you can move those so that it's a little bit harder to get to that, but your compost bin is closer, so that your donation rack is closer, these are ways that you can start to encourage your staff to do the right thing. You might have to be a little more scrutinous with what goes into a compost bin or what goes onto a donation rack, but over time that will start to become part of the culture. And the last thing I'll say, just staff-wise, is really try to find those that are really, being early adopters and champions for this work. Call them out. Really try to celebrate them in front of the team. Have your huddles, have your staff meetings where you really talk about how that's really leading by example. And, most likely if they're a leader in that, they're probably a leader in other ways and have good rapport with your team. And they'll help really spur that on. So figure out ways that you can help keep them going, motivate them, and get those champions that aren't necessarily you. Because believe me, speaking from experience, people might get really tired of hearing you talk. So now just going to some more granular little things that we can do in the kitchen and that I highly recommend you look into and take a test drive in your own operation. Cook in smaller batches. Cook in smaller batches. When we cook these gigantic batches of soups and stocks, of sauces, of even like pastas in the 10, 15, 20 pounds at a time, the room for, the margin for error is just, it's way too slim. And when you make a mistake and you have to scrap 20 pounds of cooked pasta because it's just so mushy, it's not going to hold up, that should hurt everything. It hurt your heart. That should hurt the wallet. That should hurt, every piece. And it hurts morale too, which is, something that I think we don't really realize whenever we have to throw food away. We know that puts cooks in the weeds. We know that it really just sets the mood into a place that we really don't want to be in. So smaller batches is key. It also just enhances quality. Make sure that you're going to, I'm not saying that you need to cook 5 different batches of the same soup, but maybe cooking, a big batch very delicately, so then cooling it so that you're not necessarily holding it all hot. Maybe cooking, in a smaller batch, and then if you need to, a few hours later, do it even smaller to try to keep it up with the day. But little strategies like that are really going to help you cut down on what you're having to A, hold hot, and B, get rid of because it's just either not good or it's been held for too long. So that's another little thing is when you can portion and correct, pans and heat to order. Don't make 17 lasagnas and heat them all in the hot box so that they, half of them die. If you can, and you are prepping in advance, you can make all of those in advance. You can cool as many as you feel like you can hold back. Heat the ones you need for the rush of service, and then heat to order as you go. You will find that there will be 2, 3, 4, 5 pans left in your cooler that can then be reused, that could then be donated, that then do not have to go to the landfill. Also, just start thinking of your kitchen more like find central areas for supplies. I don't know, I've been in kitchens that are gigantic. I've been in kitchens that are, so tiny for the operations that they serve. But I can tell you one thing that I see a lot as I go around is cooks really like to have their own space with their own product that they can kind of pull from, right? And when you're working a room service line or you're working a made to order line, yes, you need that kind of setup. However, when you're doing something that's more of a batch cooking, you do not need to have your own cooler filled with everything that you would possibly need for that day. Because what you're going to find is cook 1 has chicken, cook 2 has chicken, cook 3 has chicken, cook 4 has chicken, and they're not all going to use it up, and they're all probably going to be scrapping some of that. However, if we can have more of a central location and really encourage that behavior, we are definitely going to cut down on waste. So think of your, your coolers and your supply areas as central areas that everyone should be drawing from, and really try to bring your team around to the idea that we don't want to be stashing things on our stations, because oftentimes, as I've seen, that's where you get a lot of waste. So one thing that you'll actually find out is that's make friends with your dish crew, right? Your stewards, because they're going to be the ones that are telling you these secrets. They're the ones that are going to say, hey, you know what? I came in on Monday and there were 6 pans of chicken salad on my area to be dumped out and to be scrapped. And they will tell you, I'm pretty sure it's coming from this station. Really get to know. They see what comes down from a patient tray. They might come say, hey, you know what? Nobody's eating the salmon. I don't know what's up with it, but every time it comes down, almost the whole thing's there. Maybe you can, look at that, look at your recipe, see if there's something up. Maybe it's not holding right. Maybe it's just not appetizing. These are things that as you get this culture really cooked into your operation, you're going to get these type of feedbacks from your team, which is just invaluable to me. It's always something that helps me kind of keep thinking of things from different angles, which is what we really need to do. It can't just be this is simple, don't throw food away. This is a very multifaceted problem, and we need to get all angles that we possibly can. On that topic, get to be friends with some of the nursing leaders, right? Let the nursing leaders know, hey, if you're getting complaints from, your patients on certain types of foods from family members, and you're hearing, feedback, we want to hear about it. Because I know it sounds silly, but one of the best ways to avoid food waste is to make really good food, right? The better it is, the more chance that what's going to get eaten, it's not going to go to waste. So really start to become, have your ear to the ground and really start to learn, what each person, where they're seeing waste, where they're seeing opportunities. And that's really going to pay dividends whenever you come in. The other thing that I really just want to point out is get creative. When you can, I know when we are cooking for patients, we're cooking for specific diets. We really can't get too funky with what we do. However, when it comes to retail and catering, have your cooks have some fun. This is one thing that I noticed. All of my cooks would just, faces of joy. They really get to be the culinarians that they are, that maybe they had to suppress a little bit to, make some of these recipes, but they'll get fun. They'll have some fun. They'll knock it out on the salad bar. They'll do grill specials. You can get, times on the weekend where maybe you didn't have a lot of staff. Maybe if you were able to use some ingredients that were left over, some food that you had cooled down or held properly during the week, you'll be able to jazz it up for the weekend staff and for, some of the folks that are used to not getting the best stuff. So that's another really great option to both engage your staff and to really, create a better experience for the folks that are coming into your facility. So I just want to close it out here by saying that so many times we just think of, food service in hospitals as a service and not necessarily, the way we thought of it before we came into to the healthcare world. And what I mean by that is we just think like this is a job that needs to get done at any cost. And that kind of attitude just spurs waste. And the more you can start to really think about the way that you might have used to think about it when you lived and died by, things like food costs and labor costs, it actually creates a better working environment. It creates an environment that, your staff will be proud to be part of. You will be able to go to your boss and say, hey, look how much money I saved you because I cut down on food waste. And and look how happy our people are because they're not dragging 300-pound bags of garbage to the dumpster because it's getting repurposed, it's getting composted. It's just all of these things create these very positive feedback loops. And when I mean positive feedback loops, I mean they just keep feeding into each other. They keep on, spurring new ideas, spurring that momentum. And before you know it, with just, really putting yourself into this work, this should really be work that kind of rolls on its own. It'll be something that you'll have to touch in on. You'll have to make sure that, you're checking your systems, making sure things are working, that you're training new folks when they come in so that it's not like, ending whenever your staff leaves. But it should over time really become just how your kitchen operates. And that's what I can't stress enough is think about your kitchen, think about how you can redesign it. Food waste is 100% preventable. And oftentimes it's just that, blinders that we put on to get a job done that create a lot of it. And anytime that we can put a little bit of work into that, we're going to do good for, our company, for our patients, for our communities, for our world. I mean, it's like win-win-win-win situation. Super excited to be here to talk to you about it. Definitely send me any questions or ask me any questions if you have any. Thanks.
Awesome. Wow. Thank you so much, John. There was so much in that, and I'm sure everyone was able to take away a number of strategies. Thank you for being with us. We really appreciate it. As John said, he is hopefully going to join us at the end for a little bit of Q&A, so feel free to throw any questions for him in the Q&A box. So for the last part of the presentation, I'm going to focus on SB 1383, edible food recovery regulations, as well as how to set up a food recovery or donation program in order to recover your surplus food in compliance with the new law. So a quick overview of SB 1383, also known as California's short-lived climate pollutant reduction strategy. SB 1383 aims to reduce statewide greenhouse gas emissions, primarily methane, by reducing the amount of organic waste that ends up in California's landfills. So the law sets the following goals statewide. The first two relating to reduction in organic material in the landfill. So by 2025, reducing that by 75%. And then the last point, which is the point that we focus on, is recovering by 2025, 20% of currently disposed edible food for human consumption. So that's a statewide goal for food recovery. So what does that mean for healthcare facilities? So health facilities in Santa Clara County that have on-site food facilities and 100 or more beds are required to submit a food recovery report annually. This starts next year in 2025 because each report will cover the previous calendar year, so the current calendar year we're in, and then donate any surplus food that would otherwise go to waste to a food recovery organization and keep related records on site. One thing to note, there is no minimum donation requirement under the law. You are required to donate surplus food that would otherwise go to waste. As we've spent a lot of this webinar talking about, we highly recommend prevention. Prevention is the best practice. Reducing the amount of surplus food you have is great. If you have small amounts of surplus food, giving that food to employees or selling it at a discount are great strategies. But at the end of the day, if you have surplus food that you would otherwise throw away, the law now requires you to donate that food. You should, so the Santa Clara County Food Recovery Program has sent out mailers as well as emails to health facilities that qualify under the law. You should have received a mailer and hopefully emails from us as well. If you have not received emails, then please do send us an email to make sure we have the correct contact for your facility. So then how to go about setting up your food recovery program. First is finding an organization that can accept the types and amount of food that you have to donate. We have a matching tool on our website to help you do this, and I'll review that in a moment. And then a few best practices for food recovery: packaging donations in shallow sanitary containers. It's helpful to work with your food recovery organization once you've identified your partner to choose the size and method that works best for you both. We do recommend using reusable containers wherever possible, better for the environment, obviously, and also can save you money. All donations should be labeled with the type of food and the date that the food was prepared or stored. Ideally, you want to have a designated space in your freezer or refrigerator for donations. This should be labeled, and of course, staff should be trained to know where that is in order to avoid mixing up donations and food that you're planning to serve. And then using your donation records to further reduce your surplus. Again, this goes back to everything we've already discussed, but using those donation records is a great way to see what you are donating frequently in large amounts and to then reduce, make sure you're not overproducing any one item. And then, of course, engaging your team. As Heba was saying earlier, this, like with prevention for food recovery, this really is a team effort and works best when everyone's aware, engaged, and involved. And so this is our website. That the link is over there, and we'll stick the link in the chat as well. If you go to our website and scroll down to step number 3, which is connecting with a food recovery organization, you'll see a link there to our matching tool or a list of food recovery organizations there that we keep on our website. This is a list of organizations that are operating in the county and currently looking for new food donation partnerships. You can use this tool to filter by the categories that sort of most apply to your business. So you might select foods accepted there and select prepared foods if that's what you will want to make sure that you're able to donate. And so then you'll get a filtered list of organizations that accept prepared foods. You might also filter by any number of options. I do recommend there's an option to filter by the types of businesses or organizations we work with, and you can select hospitals in that one specifically or health facilities. And so you can see the subset of organizations that work particularly with health facilities. So again, we'll put the link in the chat. I highly recommend checking that out. And then food safety and liability protection, an important topic. Of course, it's important to always comply with CalCode, whether food is being donated or sold. If food isn't safe to eat or sort of appealing enough for you to want to eat it, of course, it shouldn't be donated. Keep in mind, this might mean changing your systems a little bit to ensure that food isn't left out for too long to avoid it spoiling. When it comes to liability, federal and state regulations do protect donors from civil and criminal liability, except in the case of gross negligence or intentional misconduct. One thing to note that legislation passed last year actually extends these liability protections to donations made directly to needy individuals rather than just to nonprofits. So that's the Food Donation Improvement Act. Last thing to keep in mind, date labels are most often quality and not safety labels, and so many items can actually be donated on or even a little after the best by or use by date on the package. You should ask your food recovery organization, once you've identified your partner, what their specific policies are regarding date labels. And then SB 1383 does require certain documentation to be kept on site for health facilities that have food recovery programs set up. So you'll need the following records for each organization that you work with: a copy of a contract or written agreement, the organization's name, address, and contact information, types of food that will be donated. This might be a list from the organization of foods they accept, or a list of the foods that you've agreed together will be donated. The frequency or schedule of donation, so this might be 3 times a week or as needed. The quantity in pounds of food donated per month. So this might be something that the organization you work with can provide you, or something that you're tracking internally. These records can be kept digitally or physically as long as they're available on site, and we will review them during inspections. Similarly, you should be prepared to discuss your prevention strategies both in annual reporting and during inspections. This is particularly important if you're donating only a small amount, or if you're preventing all surplus food and don't have a donation program in place. We will review during those inspections and expect to see in reporting a list of the prevention strategies that you're using to reduce that surplus food. And then, as I mentioned before, your first food recovery report will be due in 2025 based on your activities this calendar year. So be sure you're tracking those at the moment in preparation for that report due next year. So thank you all so much for joining us. We've got a little bit of time for questions now, so I think we'll bring John up if he's willing to join us up here. Feel free to throw any additional questions in the Q&A. And also, we would love to hear from you in the chat. If you've got prevention measures that we didn't mention that you'd like to share, we'd love to hear them, so you can throw them in there. A quick reminder, when you exit the webinar, you will get a link to a short survey. It's very short, and we would really appreciate your feedback if you could just fill out those questions. We'd really appreciate it. And then lastly, this webinar is recorded. We'll share it with you, and we would love for you to share it with your staff, with your colleagues as appropriate. Yeah, please spread the word.
Thanks, Kira. And I think John is also trying to manage some technical issues. So we're gonna wait a couple of seconds for John.
Can you hear me? I don't know. My camera doesn't seem to be wanting to work.
Fine. Thank you for joining us, John.
This is weird. Just I'm a black void talking, but
You're a black void, but we can hear you. Your voice sounds great.
Yeah. Thanks for joining us, John. I also wanted to mention to everyone that unfortunately Jill wasn't able to join us. She had a prior engagement, but feel free if you have questions for Jill as well to put them in the Q&A box, and we will surely get you some answers from Jill. John, I have a question that I wanted to post for you, and that is regarding the emergency food supply. So, you know, health facilities, we've mentioned earlier, they're unique because they have multiple vending as outlets, but also what makes it unique that you have to have an emergency food supply. So I wanted to kind of get your idea or kind of get your response on how can you effectively manage the emergency food supply? So this way you're ensuring that it's being used before expiration, therefore you're minimizing your waste and also maximizing that resource efficiently. Do you have a tactic? Do you have a strategy to do that?
yeah, I mean, I think when I first started managing a hospital kitchen, we had this whole section of our walk-in freezer just dedicated to our emergency supplies. And, you know, I would watch my my receiver go in and throw it away. You know, I watched him do it once and I immediately was just like totally flabbergasted and was like, why would we possibly do this? And so I immediately went to my director, I went to our emergency management team and I pulled them together and I said, look, this is just like absolutely bonkers. We should be able to figure out a better way. So I proposed that we actually design our emergency rations to be modeled off of products. We had a room service operation, right? So we had the same menu every day for our patients. So we just bought more of those things, right? That was what we based our emergency supply off of. And whenever we would, you know, we would just always have that par stocked for emergency, but we would draw from it as we needed it and replace it as we needed it. And that was a really good way for us to do it. So when you look at your, you know, most hospital kitchens have, you know, 3 walk-in coolers and a walk-in freezer and all these different areas. There are products that you will use so much that they will never go bad. And designing your emergency menu to reflect those products that are staple products and not some totally separate menu, to me, that was the perfect solution. And I can tell you, we never threw away anything emergency related for the last 4.5 years that I was there. So that was kind of the strategy we took.
That's fantastic. I hope everyone kind of replicates that strategy, because that's nice to hear that food is being not wasted and used efficiently.
Yeah, that's awesome. John, I guess one other question would be, you know, I think you said you're working throughout the 38 hospitals. And I'm just curious if there's been, was there any difficulty in sort of getting the higher ups on board and convincing the hospitals, like you were saying, you know, it's not necessarily the first focus is cost of food operations in hospitals. So what did it take to sort of get to get the higher ups on board?
I know this sounds silly, but recognition. Honestly, once I started speaking places about the awesome things we were doing in our kitchen, once we started winning a few awards, once other hospitals started to ask my president, what the heck are you doing at your hospital? That started to really catch fire. So it was a bit of a grind at first, but I kept going at it. I was told no many, many times over the first couple years. I was literally a door-to-door salesman for a composting company on the side, like just really trying to get people to get on. And it took a good about 3 years before they started saying, oh, maybe this guy isn't totally wacky. But I honestly think so. You know, obviously it's a food, you know, in food waste reduction, it's a cost savings. And there's not a single person in a C-suite that doesn't want to hear a cost savings initiative. If you can come at it with that, but also they love to brag, right? I remember about a year and a half ago, the president of the hospital that I worked at asked me to come cook a dinner for the board and speak to all of our sustainability initiatives. And that was like the day that I realized that like I had finally broken through, that like it would let me sit in front of all of the really important people of the hospital, not only cook them food, which I was pretty used to, but then talk about why I cooked them that food and all the efforts we are doing. So yeah, I think it's kind of a combination of saving some money and give them something to talk about when they go meet with all their, you know, their peers about the cool, you know, forward thinking operations that they have going on at their hospital.
That's awesome. That makes a lot of sense. And I imagine, you know, you were kind of ahead of the curve. I imagine that's also gotten easier as the sort of sustainability has become more mainstream and sort of a bigger topic of conversation generally. So maybe easier for us to jump on that bandwagon now.
Yeah, I hope so. I mean, we're definitely nowhere near California's legislation and things of that nature. So it's still all very voluntary around here. But I'm really hoping that the models that you have going out there will set an example. I know we're seeing some of that in New York, Maryland, and some other areas around us. But it's really cool to see that it's moving past like a volunteerism and more into like, this is the way we need to do things moving forward. So I'm really excited to be a part of that.
Yeah, awesome. Well, thank you so much for joining us, for sharing all your expertise. We really, really appreciate it.
Absolutely. Pleasure to be here. So nice to work with you too.
With you as well. Yeah.
Just before we log off, I think we have 1 minute left. John, you have a question coming in the Q&A, which is, have you tracked cost savings?
Yeah. So you know, it's tricky in a hospital where my kitchen was serving catering. We were doing catering, so room service for patients, and our retail operation. And honestly, half the time feeding like the entire OR because they had a lot of call-offs and they needed me to come feed them. But I did a little bit of, you know, actually have an economics degree on top of working in kitchens my whole life. And so I looked into the best way I could track it was, you know, kind of looking at like your gross like margin. So how many dollars do I need to put in to get a dollar out is really the way that I started to look at it. And whenever I started at the hospital at McGee, we were putting about $1.90 worth of ingredients to get $1 out in a retail setting. So we were almost losing half of, you know, our money on that. By the time that I walked out the door, we were at 1-to-1, which is pretty darn good for a cost center. So I never really calculated the actual like total savings in that. But what I was able to show to my boss was that we had reduced waste so much, we had tightened up our inputs, our management system of those types of things that, you know, traditionally, and I actually just looked at this for our whole system yesterday because I was getting ready to talk on this. I wanted to talk this more. Almost every single kitchen that I see across our hospital system right now is operating at probably at least like $1.50 to get a dollar out. And it's not the most scientifically backed measurement. I'll appreciate that. Also, I took a lot of statistics classes, and I'm sure 10 people could tell me that that's not the way to think about it. But whenever you try to track savings, sometimes it's tricky because you have to factor in things like fluctuations in price of goods, in patient counts, in the fact that your produce truck's refrigerator blew out and they delivered you a bunch of stuff you had to throw away, you know, like things of that nature. So I find that was really the best way for me to track because it kind of held a little bit more closely to what was going on.
That's very helpful. I hope that answers the question to whoever asked it today.
Yeah, great. Thank you so much, John. We do have one other question, not for John. I know we're over time, that I'll just answer really quickly. One that came in through registration is how likely is it that food from hospitals can be donated to organizations in areas with the highest rates of food insecurity? So that I'll point you back towards our matching tool for that. Our matching tool, again, highlights organizations throughout the county who are working on these issues, and many of them recover food and then work with distribution sites throughout the county to get that food to various populations. And so that would be a good question once you've identified a filtered list of organizations that you could work with to talk to them about the populations that they serve. If you're interested in ensuring that your food is getting to folks in your area, yeah, that's a question for them.
Awesome, Kira. I don't think we have any more questions in Q&A. John, I thank you again for the time and the recording, the time you took to record with us, as well as joining us today and answering some questions. Thank you all for joining us, and we wish you a great rest of your day.
Bye, everyone.
Thanks, bye.